indoors for short periods of time when physical distancing cannot be maintained, such as at a grocery store. A mask acts as a barrier that reduces the transmission of the virus to others. That is important because COVID-19 can spread through infectious droplets emitted by people even if they're not showing symptoms. While we are seeing more people wearing non-medical masks or face coverings in the community, there are reports of people being judged for not wearing one. The fact is that some people may not be able to wear a face covering safely. They may suffer from illness or disabilities that make it difficult to put on or take off a mask. Some may have difficulties breathing and shouldn't wear a mask at all because it will exacerbate their condition. As well, masks and face coverings are not recommended for children under the age of 2 years. We need to be understanding that for some, wearing a mask is not possible. While you may not personally feel at risk from COVID-19, the reality is that if you are infected, you could be responsible for starting a new chain of transmission that results in life-threatening illness for others. Simply put, in areas where COVID-19 is active, wearing a mask or face covering when you can't keep your 2-meter distance is an important added layer of protection. This can be seen as an act of kindness and respect for others. Actor Dan Levy puts this nicely when he said, "Imagine wearing a mask not as an infringement on your freedom, but rather the simplest, easiest act of kindness that you can do in a day." For tips on how to make, wear, and use a non-medical mask or face covering safely, check out canada.ca/coronavirus. If it's safe for you to do so, I encourage you to use this extra layer of protection in addition to washing your hands frequently and physical distancing. Of course, staying home if you are sick is a must-do. Thank you.
Bonjour. Comme à l'habitude,
Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 87,902 cases in Canada, including 6,799 deaths and 46,478 people recovered, 53%. Labs across Canada have tested over 1,559,000 people, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 22,300 people daily. We want to reiterate caution for all Canadians who are currently experiencing heat or humidity in some parts of the country. Wearing a mask can make breathing difficult. Therefore, when you are outdoors, maintaining physical distancing is best. Extreme heat can worsen pre-existing conditions and breathing difficulties. Reserve the mask for use indoors for short periods of time when physical distancing cannot be maintained, such as at a grocery store. A mask acts as a barrier that reduces the transmission of the virus to others. That is important because COVID-19 can be spread through infectious droplets emitted by people even if they are not showing symptoms. While we are seeing more people wearing non-medical masks or face coverings in the community, there are reports of people being judged for not wearing one. The fact is that some people may not be able to wear a face covering safely. They may suffer from illness or disabilities that make it difficult to put on or take off a mask. Some may have difficulty breathing and shouldn't wear a mask at all, because it will exacerbate their condition. Non-medical masks are not recommended for children under the age of 2 years. We need to be understanding that for some, wearing a mask is not possible. While you may not feel personally at risk from COVID-19, the reality is that if you are infected, you could be responsible for starting a new chain of transmission that results in life-threatening illness for others. Simply put, in areas where COVID-19 is active, wearing a mask or face covering when you can't keep your 2-meter distance is an important added layer of protection. This can be seen as an act of kindness and respect for others. Actor Dan Levy put this nicely when he said, "Imagine wearing a mask not as an infringement on your freedom, but rather the simplest, easiest act of kindness that you can do in a day." For tips on how to make, wear, and use a non-medical mask or face covering safely, check out canada.ca/coronavirus. If it is safe for you to do so, I encourage you to use this extra layer of protection, in addition to washing your hands frequently and physical distancing. Of course, you should stay at home if you are sick. Thank you.
We will now open the phone and the floor to questions. Vous pouvez poser vos questions dans les deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those who are asking questions in the room, we ask that you please make your way to the freestanding mics. Fortunately, we will start on the floor. So if you want to start on the phone, first question. Go ahead.
Good afternoon, Bruce Campion-Smith, the Toronto Star. Just wondering, following up on the Prime Minister's comments from last week where he's offered the help of civil servants to make contact tracing calls, just wondering if you know the extent that that offer may have been taken up by the provinces and just kind of the training that might be required, because it's, is it, before they start on those calls, because, you're asking people to kind of divulge their schedules, perhaps some sensitive information and all that.
Yes, I may not know the exact extent of the uptake, but I know that some provinces have taken up on the offer. I know that there's sort of training involved. Obviously, contact tracing is a very specific skill, and as you said, how you approach people, all that training is important. And so some of the public servants who are part of this cadre come from like the health portfolio, and others who are trained to do this. I know that Statistics Canada and others are also looking at contribution, and as you know, that this cadre of public servants are trained particularly in doing surveys and that type of thing as well, but there are actual specific training that they go through.
And given the scale of kind of the contract tracing calls that will need to be made, is it even feasible to think this could be done by people, or does it make it inevitable that this will have to be done by, either one single app or a combination of apps?
I know that the use of apps are undergoing active discussions right now. So I think increasing the human resource cadre is important. But I think looking at the option of how apps can assist with that is important, because if you get a lot of cases, and when there's very few cases, things can be done quite rapidly. But if you plan for a scenario where there's many more cases, then I think that people are interested in the applications and looking at the features of them, though, in terms of privacy and other considerations as well.
Thank you. Next question, Julie, CBC.
Julie Van Dusen, CBC. Dr. Tam, how concerned are you about reports of inflammatory syndrome affecting children in Canada? Do we know for sure it's linked to COVID-19, or do we have to wait for antibody tests to be available?
So I think as I've said, the number of cases and the severity of illness is much less in younger age groups. Nonetheless, though, the pediatric hospitals and pediatricians have been alerted, and some of them are sort of looking out now for this multisystem inflammatory syndrome or Kawasaki-like illness, which is a phenomenon that is seen post-infection. So it's more like an immunological phenomenon, which is associated with other viruses and other infections. It's generally rare, but I think with the increase in awareness, people are looking for specific cases. And there are a number of kids that have been found with this spectrum, and I even think the spectrum of illness is still being collected as well. So they are analyzing that information. And so far, there's no specific link to COVID-19. I know that in some hospitals, for example, in Toronto, they haven't actually found any PCR positive cases. But as you've said, looking for antibodies is another option when that's available. So investigators are collecting some samples in anticipation of further studies. But again, I think for parents out there, this is a rare condition. But if you do, if your kids have a high fever, that's lasting longer than a couple of days, you have rashes, swollen limbs, or other concerns, then please do call your pediatrician. As I've said before, there are safe ways at which you can access your primary care and other health services, so don't forget to do that.
And on the subject of testing, which we talk about all the time, I'm just wondering, how indicative is it for a person to get a test about what's really going on in the community when you can get your test, it's negative, but you contract the virus 2 days from now? Like, what kind of picture does it tell you unless people get tested often?
So I think what you're describing is the tests that are available at the moment are there to detect the virus or the molecular tests. And so they are there to detect, as you said, today you may be negative, but you still have to keep watching out. If you think you're at risk, you have to keep watching out for symptoms. That's the only other way. Even mild symptoms, people should be encouraged, particularly in the areas where there are hotspots in Canada. Those are the areas where people need to be quite vigilant, even with mild symptoms, to present for testing. I know that locally they're trying to make the test more accessible, like through mobile clinics. But based on what I've heard is that people may not be showing up to be tested. So I think if you have symptoms, even mild symptoms, please consider going to get tested. If you have a negative test, though, that might not mean very much at this point. And so a positive test, you're going to be managed as though you're a case, and contact tracing will have to be initiated. If you are test negative, continue to be vigilant and do all those things that we've asked people to do. And, staying home when you're sick is one message. The other is get yourself safely to a testing clinic where they have all those sort of infection control measures in place to actually test you is actually very important. But we can track the projection of the epidemic right now and know where these hotspots are. So I think these kind of results are important to look at the population epidemic trajectory for sure.
Thank you. Next question, CTV.
Hey, Dr. Molly Thomas, CTV National News. Dr. Tam, Alberta's Premier and Chief Public Health Officer are crafting guidelines around Edmonton possibly being a hockey hub come July. Should we be letting hockey players come across the border or coming in from Europe, especially when we have families that are having trouble being reunited because of those really strict guidelines?
Yes, so those are very important considerations, and you've asked a number of questions. And so protecting the Canadian population, it remains the key objective. So as with any resumption of activities, be it sports or professional sports, we're looking at, what guidance need to be in place to protect any potential risk to the Canadian population. So I think right now at the Special Advisory Committee, we're going to, be looking at what the guidance is being laid out for these sports-related activities. So there'll be sort of public health fundamentals to making sure that plans and protocols are in place, no matter which sport you might be contemplating reopening. Having said that, I do know that there are proposals, of course, from these leagues, including the NHL, and those proposals are being reviewed in terms of whether they continue to keep Canadians safe. And for now, really, our strict mandatory 14-day quarantine applies at the international border.
So
So let me ask you, Dr. Tam, then, has the NHL put a proposal before you? I mean, we know they've talked to Alberta's premier. Have they put a proposal before you? And I mean, have you spoken to any public health officers specifically about this?
We are in the process of having those discussions right now. Personally, I haven't interacted with the NHL, but I do know that different departments are engaged with those conversations right now.
Thank you. We'll now go to the phone operator.
Yes, thank you. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. And the first question is from Laura Osman from the Canadian Press. Please go ahead.
Hey there, Dr. Tam. I want to start by asking you about New Brunswick. They decided to push back their recovery plan for part of the province after a single traveler didn't self-isolate and infected at least 2 other people. What, in your opinion, should the criteria be for rolling back reopening plans? And do Canadians need to expect these kind of setbacks in the next few weeks and months?
Well, I think every medical officer of health agrees that we need to be really careful as we sort of resume certain activities and relax public health measures. So this is, an example of people watching those trends really carefully. I think there's always been the message in different jurisdictions that there's a flexibility in the public health system to reinstate or pull back on some of the measures as they see fit based on their own epidemiologic context. So I think that's is what you're seeing in New Brunswick at this point.
Laura, follow-up.
Thank you. Looking internationally now, in some countries we consider our peers, we've seen some really sharp declines in COVID-19 cases over the last few weeks, whereas Canada seems to have really flattened the curve but not necessarily turned it downward. Does that concern you, and why do you think that's happening?
So I think, again, Canada has made progress and, as you say, flattened the curve, and our health systems are not overwhelmed. But there's still a significant number of outbreaks and impacts on some of the most vulnerable settings, which is what you're seeing right now as well in long-term care and other settings. There are some workplaces reporting cases. There are still some community-acquired cases in certain areas, but they're not all over Canada. So many different areas of Canada, things are well controlled, and they've managed to really flatten the curve and maintaining that. So I think Canada, as I've said, is a series of regional epidemics. And so the key provinces at the moment that's experiencing the most cases, the vast majority of cases and the severeness is Ontario and Quebec. And even within those jurisdictions, you need to sort of home in on more specific areas. And I was really, that's how you're going to, make progress with the decline in cases, is actually putting your vast efforts at helping those specific hotspots as they are trying to get things under control. I was actually really happy to see some of the sort of granular data coming out of Toronto, for example, yesterday, showing which sort of areas have higher cases than others. And those kind of strategies in targeting specific localities where you may want to offer more testing and access to testing and access to other resources to help get the outbreak under control, I think is a very key aspect of bringing that curve down.
That's all we have on the phone. So we're going back to the room. Global News, Mike.
Hello, Dr. Tam. My question today is about non-COVID stuff from a public health perspective. When are we going to relaunch the medical system for surgeries, dental care, all these other things that we put on hold for the past couple of months? And how can we do that? That's
an incredibly important question. in many ways, some of those services hadn't been completely shut down. But what we're hearing is that some members of the public might be staying at home instead of actually accessing available services virtually or in person, and it's actually safe to do so. There are actual primary care and services still available, and that they must not neglect their medical conditions because that could lead to negative outcomes. What you're also seeing is that in some of the very initial phases of resuming normality in the health system in multiple jurisdictions, is that that's one of the first things they're looking at now is the resumption of elective surgeries and some of the other aspects of regular prevention measures is really important. That is part of the jurisdiction's first areas of going back to resuming essential services, really. So I think it is a very important message to Canadians, is that please do get your regular appointments. But I think each province, where this, of course, is a provincial jurisdiction, gauging their health system capacity and seeing how they are actually implementing this on the ground.
Okay. Yes. So for whatever reason that these problems haven't been addressed, we now have a pretty big backlog of people on top of what we would normally have during the regular medical system day. So how do we deal with this backlog that's been created over the past 3 months?
I'm sure that's a very complex and serious issue or challenge that all provincial, health systems are grappling with right now. But I would point it back to the province because I actually don't know the details on the ground.
Thank you.
Thank you.
Thank you. I think we have time for one more round in the room if you have any other questions. CBC?
Dr. Tam, I've heard that they're telling, in schools where it's really hot, don't bring your little battery-operated fan in because it could spread the virus. And there's been talk about air conditioning, and of course a lot of the seniors' homes in Quebec don't have air conditioning. Does anyone know for sure, is it a problem? Can it spread through air conditioning, or is that an open question?
So we're always studying this virus because it's so new, but I think the concern is not necessarily spreading through the air conditioning, but is the sort of airflow, is sort of the air coming out of the air conditioning system and what that may or may not do. So I think, part of the installation of, whether it's individual, I think that what I heard in the Montreal area is that actually providing these individual air conditioning or fans in people's rooms. So I think being able to separate people and still provide them with cooling options is really key because they cannot sort of maintain physical distancing and be in a sort of room necessarily in some of the traditional areas where people are offered cooling options. But I do know that there's also some of these emergency cooling centers where they are instituting infection prevention and control measures at the same time as offering places where people can cool down as well. So I think that local public health is looking at all of these considerations as they're offering these settings where people can go and cool down. But I think in the long-term care facility, absolutely, it's really important because not just the COVID-19 susceptibility, we know from previous heat waves that seniors at the highest risk. So hydration is really important as well as the temperature options.
Next question, Sean Starr.
Dr. Tam, are you satisfied with the current level of contact tracing, and is it happening at a level that will support the lifting of social restrictions? And how important is that to the process?
So based on our very regular updates from the provinces and territories, they do have contact tracing abilities, and they are able to rapidly do the contact tracing. But of course, numbers are lower at the moment than they were before. And so what they're doing is just planning for surge in case there is a resurgence of cases, and everyone's planning for a potential sort of seasonal fall wave. And so it's more of that forward planning, making sure people have trained contact tracers, including medical students or other sort of surge capacity. But they're going to have to look beyond that in case, these people go back to their regular jobs, and then we're sort of looking at, well, how can the federal government then provide a surge even behind that? So I know that provinces are actively considering those offers, maybe not for what they need now, but for a potential surge if they need it.
Thank you.
Next question, CTV.
Dr. Tam, Ontario released more info yesterday showing us the cases and where they are around the province, but I wonder, about heat maps. We look at Montreal that has a heat map kind of showing you where the worst neighborhoods are, the same in Ottawa, ward by ward. Is it a problem that Canada's largest city doesn't have a heat map?
I am not sort of the expert in that area, but I think, obviously tools that are able to provide more localized information is, going to be very helpful. I think whether it's floods or heat maps, I think it's going to be very helpful to individual cities to have that. What I do know, as I've just said, is that Toronto releasing the information on where they have the highest rates of COVID-19 is very important. That's a sort of heat map of COVID-19. And then potentially you can sort of overlay that with information about heat as well. I don't know the level of granularity that you need for heat. I mean, obviously, it's likely to affect the whole city of Toronto if there is heat. But I think most importantly is to be able to have the localized message on where people can get support to cool down if they need it.
I guess my question is more about the neighborhoods. Like, should Toronto be showing us if the West End has more cases than the North End? Sorry, the heat maps are kind of what these experts have been calling them. I should have clarified that. But in terms of neighborhood breakdown, not the temperature, sorry, that's my fault. But Dr. Tam, should the neighborhood breakdown be there in Canada's largest city?
Well, I think as far as I can tell, the what Toronto put out is going to be very helpful for them to target where they're going to be looking for cases, for sure. I think, of course, local medical officers of health do have an understanding of their community. So I think that is the best place for them to answer the question as to what is the most helpful. But I think that it would not be surprising to find that, as we all know, the populations most at risk are those that are most vulnerable. People who are maybe living in poverty, with more crowded conditions, with less access maybe to some services. And so I think what you will probably find is that as one did in Montreal and others, those are the population that you must try and help. I mean, it's not unusual. I think we know what those maps is probably going to tell you. Even if you mapped it down to the street level, it's going to tell us that precise observation that we have to help the most vulnerable.
My last question, I'm just going to circle back to the sports question because I love sports. Dr. Tam, do you think, I look at Edmonton, and obviously in terms of cases, when you compare it to Toronto or Vancouver, is much lower, but do you think it would be safe anywhere in Canada to have a major sporting event?
I think, again, protecting the Canadian population is the paramount importance. So that's some of the discussion currently ongoing with the medical officers of health on the ground where these events might take place. So I think, as I said, this is currently active discussion, and we do need to see the proposals laid out from a sort of how is the population going to be protected. So that's I think the common goal.
Thank you, doctors. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Merci.
That concludes today's press conference. Thank you.
That was Canada's Chief Public Health Officer, Theresa Tam, and also there was a Deputy Chief Public Health Officer, Howard New, but questions, of course, to Theresa Tam. Starting off by saying, continue to wear a mask if you cannot social distance by that 2-meter space because you are being kind to other people. There were also some questions, interesting questions, as people get a little antsy for things to do about sports and big gatherings. Those discussions, it seems, are underway as to how to go about putting on perhaps a game safely. CBC's Catherine Cullen has also been listening. She joins me live from our nation's capital. Catherine, what really stands out for you?
I think probably the most interesting thing Dr. Theresa Tam said there, Suhan, although you're right, she touched on a bunch of topics, had to do with the question about the NHL possibly having a presence in Canada and the challenge that would be part of that in having players come across the border having to do a mandatory 14-day quarantine self-isolation if they were coming from the U.S. or abroad. She did say that those discussions are happening. They're happening on a bunch of different levels, that she hasn't personally spoken to the NHL, which I thought was one of the more sort of remarkable moments, interesting moments of this pandemic, where we have Canada's Chief Public Health Officer talking about having discussions with the National Hockey League, but she said she hasn't personally had those conversations yet. She did say, for now, the strict 14-day quarantine applies at the international border. So the discussions are ongoing, but there was no clear news from Dr. Theresa Tam out of that. But you're right, she talked about other sports as well and about setting forward guidelines to try to keep people safe. We know that that is a complicated issue. A lot of sports involve a lot of physical contact, so how can you modify, even just on your local baseball diamond, how can you modify behaviors and still try to keep the spirit of the game when people are, as you say, pretty antsy these days in some cases.
Absolutely. Another good question came from one of our colleagues, and that was Julie Van Dusen. We just went through a hot spell in Toronto. I know you did in Ottawa as well. And then there are questions about air conditioning and those little personal fans. And what about people who are in a situation where they're sharing perhaps a home with other people in the house and they're renting a room? Did you take away anything on that?
I did think that what Dr. Tam had to say was interesting because, of course, part of the discussion right now about how COVID-19 is spread, there has been a lot of attention to ventilation systems. And so would a broader air conditioning system, I believe Julie referenced the example of situations in schools, but Dr. Tam also talked about long-term care facilities. What are the implications of turning on that air conditioning when it is a sweltering, let's say 37, 38 degrees? There are concerns, particularly when it comes to seniors, about them coping with that health, but that heat rather, but at the same time concerns about spreading of COVID-19. So Dr. Tam talked about the possibility of using individual air conditioning units in places where people are socially isolated. She seemed to be suggesting that that was the best possible option. There's also the possibility of cooling centers, which we would normally see during outbreaks, but she talked about the importance of implementing infection control protocols in those situations. So yes, there's a place to go if you can't handle the heat, if you need some help cooling down, but trying to protect people as they come. Certainly it will not be summer as normal, but hey, that is an understatement. I mean, everything is changing, and this is just one more instance and one more complication, I guess, in an already complicated public health situation.
Exactly. Thanks for that, Catherine. CBC's Catherine Cullen in Ottawa. CBC News has continuing coverage of this COVID-19 pandemic here at home and around the world, so stay with us. We're back in just a moment.